Hey, if you're dealing with that kind of nagging, persistent pain or stiffness, or you just feel like you're not moving the way you should be, you've landed in the right place. Today, we are diving deep into a really fascinating technique called IASTM, and it's totally changing how we think about healing and movement.
So, does this sound familiar? You know that one spot, that nagging pain, or that stiff area that just refuses to go away no matter what you seem to try? It's such a frustrating cycle, right? Well, there's a modern approach that's designed to finally break it.
So what exactly is IASTM? Well, it stands for Instrument Assisted Soft Tissue Mobilization. I know, that sounds super technical, but just think of it this way. A trained professional uses these specially designed tools to have a gentle, really productive conversation with your body's soft tissues. We're talking your muscles, your skin, and that amazing connective web called fascia that holds everything together.
Okay, so when you see these tools for the first time, I get it. Your first thought might be scraping, but I really want you to reframe that idea completely. These are not scrapers. Think of them more like precision instruments, almost like antennas that are designed to communicate directly with your nervous system.
And you know that whole idea of communicating instead of scraping? It brings us to a huge myth in the world of manual therapy. For years, the goal was thought to be about aggressively breaking down tissue. But oh man, the latest science tells a completely different story. We've all heard it a million times, right? No pain, no gain. The whole idea that for a treatment to really work, it has to be aggressive, maybe even painful. Well, modern IASTM is moving in the exact opposite direction.
See, the old model was all based on this idea of fibrosis. The belief was that our job was to just violently break up these knots of scar tissue, kind of like trying to smash a tangled bunch of spaghetti. But the new science shows it's rarely scar tissue at all. It's actually something called densification. This is where the fluid in our connective tissue gets thicker, almost like honey that's gotten hard in the cold. You don't need a hammer for that, right? You just need to gently warm it up and get it flowing again. And that requires a smart, responsive approach, not an aggressive one.
Now this number really puts things in perspective. Researchers calculated the amount of force it would take to physically stretch our fascia by just 1%. And the answer was just astonishing, 2,000 pounds per square inch. That is way more force than any therapist could ever possibly generate. It's solid proof that we aren't physically breaking anything down. And just to hammer the point home, a leading fascia researcher, Dr. Robert Schleip, says the idea that we're manually forcing change in this incredibly tough tissue is, quote, impossible to conceive. So that begs the question, right? If we're not breaking things up, what in the world is actually happening?
And this is where that new conversation really begins. We're shifting away from a mechanical model of force to a neurological one of information. See, ISTM isn't about changing the tissue itself. It's about changing how your brain perceives and controls that tissue.
So, here's the absolute key takeaway. The main target of IASTM is your nervous system. The whole goal is to send new, safe, and clear information up to your brain, convincing it to dial down the pain signals and allow for more freedom and ease of movement.
This image is just the perfect metaphor for it all. We're not crushing muscle, we are literally feeding the brain. The tools create this rich stream of sensory information that helps clarify the brain's connection to that part of the body, making that connection stronger and way more efficient. Here's a great way to think about it. Your brain has this incredibly detailed map of your entire body. But after an injury or because of chronic pain, parts of that map can get kind of smudged, a little blurry. And when the map is fuzzy, the brain gets confused and defaults to protection mode, which means creating pain and tightness to stop you from moving into what it thinks is a danger zone. So how does this actually work? Let's follow the signal's journey. First, the tool glides over your skin, stimulating all these little nerve endings in the fascia. Then that signal zips up the spinal cord to the thalamus, which is kind of like the brain's central relay station. And finally, it arrives at a place called the insula. Think of it as the well-being center of your brain. By sending this gentle, clear signal, we're tacking directly into the body's communication highway to dial down that sense of threat and dial up the feeling of safety. Okay, so on to the big question. What does this actually feel like? If you're picturing some intense, painful experience, just think again. The modern approach is all about being gentle, specific, and incredibly effective. The sensation can actually vary quite a bit, and it all depends on the goal. A practitioner might use these incredibly light, almost feather-like strokes, and those are designed to calm the nervous system and tap right into those well-being pathways we just talked about. Or they might use slower, more specific strokes to really encourage relaxation and improve the glide between different layers of tissue. The bottom line is, it's all tailored to what your body needs in that moment.
This quote really says it all. It's easy to be heavy, hard to be light. The true skill of IASTM isn't found in brute force. Not at all. It's in the precision. It's about using just the right amount of input to have a really productive conversation with the nervous system. It is all about finesse.
All right, so who is this approach actually for? Let's take a look at who can benefit the most from this neurocentric way of working with the body.
You know, the applications for this are just incredibly broad. Of course, it's fantastic for things like limited motion or pain when you move, but it's also for that recurring tightness that just keeps coming back, or for inefficient movement patterns. And maybe most interestingly, it can help if you just feel disconnected from a part of your body. All of these are just signs that the communication between your brain and your body could be improved, and that is exactly what this work is designed to do.
So, the big idea is this: by shifting our focus away from breaking down tissue and towards communicating with the nervous system, we open up a whole new world of possibilities for healing. It's about working smarter, not harder, to help you feel and move your absolute best. So the only question left is, are you ready to start a new conversation with your body?